Slap tear rehab, slap tear load management, progressive overload, periodization, everything that you need to know about how you can rehabilitate slap tears without surgery and any other traumatic shoulder injury. Surgery is not the best option for you if you have a slap tear. It should always be considered a last resort. I have personally rehabilitated a slap tear in both shoulders without surgery. I'm back to full capabilities and I'm even stronger now than I was before my slap tears. And I've done the same now for hundreds of people around the world, all verified by our Google reviews. We have some great stories of people who were told that surgery was their only option by doctors and surgeons, and now they are doing things that they couldn't do even before their slap tear. So what I'm going to share with you works, and I'm going to teach you what load management means for slap tears and shoulder injuries. How to use progressive overload and periodization so that you can fix your slap tear without pain, without surgery. And if you don't know who I am or who we are, my name is Rad Burmeister. We are Unity Gym, where we teach people who are busy parents over the age of 40, people who are getting on in their life a little bit, who want to be able to perform at their best, teach them how to overcome injuries, how to return to peak performance, and how to get stronger and more flexible than they ever have been before with efficient workouts that fit into your daily life. Because as a parent, I'm 47 this year, I have a lot of responsibilities and workouts have to be efficient. I don't have the time to work out like I used to when I was younger. None of us do at our age, and that's what we do here. So let's get into it. Load management, one of the biggest mistakes people make with a slap tear is, one of the first mistakes is that they think that rest will fix it. Rest will not fix a slap tear. When you have a slap tear, you've torn your labrum. It is a traumatic injury that the majority of doctors and surgeons will tell you need surgery to fix. And in a way, it's true. The slap tear itself won't actually fix and repair without surgery. But here's the kicker. In 60% of cases, surgery does not make symptoms better from a slap tear. And the symptoms are what you need to worry about. Because if I got an MRI tomorrow, it will still show that I have a slap tear. But I'm symptom free. I can do everything that I want to have, full range of motion, and I can do all my strength training. In fact, I'm even stronger now than I was before the slap tear. I've built more muscle in my upper body since I did my slap tear, more muscle than I've ever had in my life. So surgery should always be considered a last resort because it's always something that you can do. You can always go and do surgery. If everything that I'm telling you doesn't work for you, then surgery is always an option, but it is something that you can never undo. You can never decide, you can never get the surgery, realize that it didn't make your symptoms better. Sometimes it even makes things worse. And you'll never be able to undo that. You'll never be able to say, hey, you know what? This didn't work for me. Let's undo that surgery. I'm going to try a different route. So keep the surgery as a last option, not as a first option. And hey, if you're watching, especially on YouTube, please subscribe to my YouTube channel. Take a moment, hit that subscribe button. It really goes a long way because I put a lot of effort to put this great content out there for you guys. And the one thing that you can do for me is either follow me on my social pages on Instagram or TikTok, or subscribe to my YouTube channel. It really helps me know that this content that I'm doing is valuable and worthwhile for you guys. So what we're going to talk about now, so why is rest not best? Because the only thing that rest does is that it's going to potentially reduce the inflammation. So when you have a traumatic injury like a slap tear, there's going to be inflammation associated with it. You're going to get impingement as well in the joint. So what happens is basically inflammation is it's the nervous system kind of trying to lock down the joint and trying to restrict the movement to prevent further injury. So inflammation, you get inflammation in the area. Inflammation causes pressure on nerves and many other things. And so that when you try to move your shoulder, you feel these sharp pains and you just can't move the shoulder. You know, when I had my slap tear first, I couldn't get my arm up past here. That was agony. I couldn't move it out to the side and I was just really, really restricted. And rest will allow the inflammation to subside, but the underlying issues that are causing the inflammation, the slap tear, the lack of strength and the lack of function in the rotator cuff and the scapular stabilizers is still there. But what happens when you rest is that your muscles are beginning to atrophy and you start to lose strength and function. So it's a major issue because the longer you rest for, the weaker you become and the more prone you are to other issues in your body. So what you really want to be doing is getting straight into doing strength training. And now we need to talk about load management, because now you're thinking, well, I can't strength train. If I try and do any of the exercises that I normally do, it hurts me. And that's because you don't understand load management. Load management is the combination of intensity and volume. Put intensity and volume together, that's load. And load is so we all have a load tolerance, we have a load capacity. And when you think about your load capacity, imagine it like being like a cup, and the load that goes into the intensity and the volume is like water going into the cup. And when you exceed the capacity of your cup, the system will start to break down. You'll start to experience pain, injury, and potentially even more. L is saying, am I able to sleep on my side with no pain? I am able to do everything in my life without pain. So absolutely, I can. I couldn't when I started. When I started, I was in agony. When I started, everything caused me pain. When I started, I couldn't take my shirt off. Like if I tried to take my shirt off, it was a real mission, because I couldn't use the arm that had the slap tear to get my shirt off. Like I had to kind of try and hike it off like that. I couldn't reach for anything up high. Like even just if I wouldn't be feeling any pain, and then I'd try and reach for something and I'd go, I'd get this sharp pain in my shoulder, and then I'd try and lift my arm up and I couldn't do it. And remember, I had it in both shoulders. So I fixed a slap tear in one shoulder, and 14 months later I had a slap tear in the other shoulder. So I went through this twice. And so your load capacity, if you think about, when you go to the gym and you do a workout, if you've already put load in the cup, just throughout the day, doing what you do, then when you go you've already filled your cup up halfway with load from picking things up and from grabbing things and doing whatever, and your shoulders already had so much load put onto it. And then when you go to the gym, just doing what you would consider a basic workout is going to overflow that cup. And so then you blame the workout and you think, this exercise is bad, I need to rest. And that's the all or nothing mentality, which is devastating for fixing injuries. You do not want to approach a slap tear with all or nothing, which is I can either do all my workout or I can't do any of it and I'm just not going to do it at all. Some is better than none. And the kicker here is that when you have had a slap tear, your cup has probably, your load capacity has probably turned into a shot glass now. The load that your shoulder can take now is so much less than what it could before. So now we need to talk about load management. So load management is basically making sure that you never exceed the load of your little shot glass, maybe even your little thimble. And there's multiple ways that we do that. We reduce range of motion in exercises. We reduce intensity, which is how heavy you're lifting. We reduce volume, which is the amount of reps you do in a set, and the amount of sets you do in a workout, and the amount of workouts you do in a week. We manipulate tempo. So tempo is another big part of load management. And we also change exercise complexity. So there's the 5 variables that you have for load management. Now, so what does that look like when you have a slap tear? In the earlier phases, we're talking about doing dramatically reduced range of motion. So something that is really painful when you're in the earlier phases of a slap tear, number one is flexing your shoulder. So this is shoulder flexion when the arm moves up above the head. So we talk about the shoulder joint here. That's shoulder flexion. That's shoulder extension, okay? And excessive shoulder flexion or shoulder extension is going to cause you pain. So if you lift your arm up past here, for most people, that's agonizing. You won't be able to get past there. And also at the same time, to try to lift your arm further back behind you is also going to cause agony, and both for different reasons, but both because they're putting excessive pressure on that the labrum on the front where the slap tear is occurring. So an example of how we use load management in the earlier stages of slap tear rehab is, instead of doing a shoulder press or a chest press or a bench press, which are all probably going to cause you a lot of pain, shoulder pressing would be the worst, or a dip, like forget dips, what we do is we do a floor press, a dumbbell floor press. So where you lay on your back on the ground, and what that means is that when you're coming back into shoulder extension, your elbow will stop when it hits the floor. So it restricts the range of motion, so you can't go past there. And then when you press, you can't go past there. So it's a very small range of motion. And that might seem like you're doing nothing, but you're not. You're doing strength training. You're you're reinforcing to the nervous system, to the brain, that exercise is okay, and the brain and the nervous system adapt, and it will start to allow that range of motion without creating tension that causes inflammation, that causes pain. And then by using program periodization and progressive overload through program phases, so a program phase would last for 4 to 6 weeks, you would then increase the range of motion. So an example of the way that we increase the range of motion in that second phase of slap tear rehab is that we then go to a dumbbell chest press on a bench. So all we've done now is we've taken the range of motion from here, where all you're doing is that really restricted range of motion, and now we're just going further back into extension. Okay, but we're still pressing in the horizontal plane, so the arm still isn't coming up above the head. And then from there, we go to a 15-degree incline chest press. So now instead of pressing to here, because you're now on a 15-degree bench, it means that your arm's pressing to here. And then we go to a 30-degree incline. And then eventually you work up towards doing shoulder pressing and behind the head pressing and all of that stuff. So that's an example of load management with range of motion being the variable that we manipulate as the program phases progress and as your symptoms the pain starts to subside. So then we have intensity, of course, as well. So we look at increasing the amount of weight, but before we do that, we use volume as the variable for progressive overload. So we always have a rep range, and the rep range will be at the start of your programming for slap tear rehab, usually between 8 to 12 reps. And so you'll have a rep range and the idea of the rep range is that whatever weight you're doing, you fail somewhere between 8 to 12 reps. Now, failure when you have a slap tear is different to what you think failure would be in a regular gym workout, like a bodybuilding workout. Failure will be when you can't continue to do the reps pain-free. So when pain starts to kick in, or when you can't control the technique correctly. So when you can't do the concentric phase of the repetition with correct technique. So the phase where you're pushing against gravity, where the muscles are shortening. And when you fail, when you achieve 12 reps or the upper rep range of all of your sets, then we can increase the weight very incrementally, a very small amount. But then when you increase the weight, there's an inverse relationship between increasing weight and reducing volume. So if the weight goes up, then the amount of reps that you can do is going to go down. So then you repeat that process again. So you've done your 3 sets at 12 reps, and you're doing, let's say you're doing 10-pound dumbbells in each hand, and then you go up to 12.5-pound dumbbells in each hand, and you're going to drop back down to those 8 reps, and then you use progressive overload to get back up to 12 reps. And so that means that in each workout, you try to add 1 rep on 1 set, 2 sets, or all sets. So even if you can get 1 rep on 1 set, so if you do all 3 sets at 8 reps, if in the next workout you can do the first set at 9 reps, and then the last 2 sets at 8 reps, and then the next workout you do the first 2 sets at 9 reps, last set at 8 reps, and then in the next workout 3 sets at 9 reps, then the next workout, the first set at 10 reps, the other sets at 9 reps. You see where I'm going with this? That's a way that you use progressive overload within workout to workout, so that you work up towards being able to do those 12 reps for all 3 sets, and then you increase the weight again and you repeat. So now we've talked about how we use range of motion. Range of motion is something that we manipulate from program phase to program phase. I'll talk about what that is in a minute. That's something called periodization. And then we've also talked about how we use progressive overload for volume and intensity. Now, the problem that people have with this, and this doesn't just go for slap tears, this is something that as a coach that I see with people all the time, is people don't respect what micro gains add up to. People are always looking for these big jumps. Like people are going for, oh, well, I can do this exercise pain-free. This is okay. So I'm going to try a shoulder press now. And then the shoulder press causes all this pain for them. And they're saying, well, this is crazy. I just can't make any progress. I can't get any better. Every time I try and go back to a bench press or a shoulder press, it's causing me too much pain. And it's too big a jump. They're jumping too far. And the same thing goes with the amount of weight and the amount of reps that people are adding per workout. If you think about it, if you think about if you were to be able to increase the amount of reps that you do in all sets by 1 rep in every workout, every single time you do a workout, you are able to do 1 more rep than you did last time. And then that would mean that every 3rd or 4th workout, you would get to the upper rep range and you'd be able to increase the weight, and then that process would repeat. How would that add up over a 6-month period? It's incredible how much more weight you would be lifting. That's how progressive overload works. And you don't just need to take my story word for this. If you want to see a real life story, I'm in the process of interviewing a bunch of our members who have had success with the programming that we use. And if you follow me on YouTube, you may have seen some of these videos. But any of you that are watching right now, I can see we've got a whole bunch of people on the live streams on all socials. I'm guessing that you guys have slap tears. Can you guys comment? Can anybody tell me on Instagram, on TikTok, or on YouTube, say, I have a slap tear? And if you don't have a slap tear, say, I have this shoulder injury, so that I know why you're watching this and I can help you. So if that's you, if you've got a shoulder injury, if you've got a slap tear, then you should, I owe it to yourself, go to my YouTube channel, and in the last week and a half, I think it's like 4 or 5 videos ago, I posted a video of a guy named Freezy Fang who's all the way over in China. He lives in China. He could barely speak English. He had to pre-write the answers to his questions so that he could read it off a script, because English is his second language. But have a look at his recovery, and his recovery period was over a 12-month period. He went from everything that I described, where he couldn't lift his arm past here, he couldn't do anything, he was in all sorts of pain. He was told by doctors and surgeons over there that his only option was surgery, that was the only thing that would fix it, but he couldn't afford it. It was way out of his budget. They don't have healthcare over in China, and the cost of the surgery was like $10,000 or $15,000 for him. Nathaniel Radke is saying slap tear, arthritis in lower back, and bad knees. You and me both. When I got my MRI on this shoulder, slap tear, torn supraspinatus, arthritis, and fluid in the bursa. That was that shoulder. This one I had a slap tear, torn infraspinatus, and I can't remember what the other thing was. I also have spondylolisthesis, spondylosis in L4 and L5 in my lower back, and I have a pars fracture in L4, a bilateral pars fracture, and I have a torn meniscus in my right knee. Yet I can do everything that I want to be able to do without pain or without restriction. So I went for a run this morning. I go running 3 times a week, no problems. I still do soft acrobatics and things like that. I was deadlifting yesterday. I did 130 kilograms, which is 286 pounds. That's with the back issues that I have. Everything that I'm talking about works for almost all sports injuries. So this process really works if you apply it. So now we talk about program periodization. So program periodization is where people think that, like, I see this a lot as a coach. People get a set of workouts and they call it a program. So people buy a program online and they get given a sheet, that's got a bunch of exercises together that puts a workout together. That's not a program. That's a set of workouts. A program is over a period of time that has an end goal that recognizes where your start point is and where you want to get to. And then it's a series of workout programs, which we call a program phase or a mesocycle, that get you to where you want to be. So let's say for a slap tear, you're here on my microphone, that's where you're standing, and this is the point where you can't lift your arm, you can't do this, you're in pain, you can't play pickleball, you can't play volleyball, you can't play basketball, you can't do jiu-jitsu, you can't do whatever it is that you love to do because of the pain from your slap tear or your shoulder injury is preventing you. And you want to get to pain-free and being able to do your sport without any restriction. So that's the gap there. A program is the series of program phases that uses what I'm talking about to get you there. It is not one step. It's not, here's your workouts, do these 3 times a week and you'll get there. That's not how it works. Because what happens is our bodies adapt to stimulation. So when you get a program, if you're getting the right program for you, a program should always be personalized. It should always be tailored to your goals and your needs through assessment and through a coach watching the way you move and looking at how you adapt to what the current program phase is before running your next program phase. So it's the right dose of exercise. It's the right thing to take you just to that next level. And that next level is a little bit less pain, much more confidence, because you start building hope. You're like, wow, this is working. I can feel it. It's happening. It builds confidence in what you're doing. And then the next program phase is just a little bit more challenging. A range of motion that's a little bit more challenging than the last range of motion that you were using in your last exercises. And remember, I've just talked about pressing. There's also rowing exercises. There's external rotation, internal rotation exercises. There's scapular stabilization exercises. There's a whole bunch of different things that we have to do in slap tear rehab. So then, and that program builds on the last program, and then the next program builds on the last program, and then the next program builds on the last program. And when you look at one program to the next, it looks like, oh man, this is too easy for me. Like it's really not challenging me that much. I've got another great story that you guys can watch, which will really help you to understand this stuff as well. Again, if you go to my YouTube channel, I just posted a video from a woman named Genevieve Nell, who's been working with me online for 2 years now, and she's a very strong, very capable person. She didn't come to work with me for injuries. She came because she wanted to unlock more advanced calisthenics strengths, and she couldn't do pull-ups at all, and she couldn't do pistol squats, and now she does pistol squats, and she can do weighted pull-ups, and she could do unweighted pull-ups for 5 or 6 reps with really good technique, like full chest to bar pull-ups, full range of motion. And when she started with me, the first program phase that I gave her, she came back to me and said, oh, this is too easy for me, Rad. I want something more challenging. And I explained this process to her. She trusted the process. And then, she's posting all these videos in our coaching forums of, achieving personal best and things that she could never do before, because every program phase builds a tiny bit on the last one. And so again, go and watch that video. It's on YouTube, Genevieve Nell's story. All of these videos have been posted in the last 2 weeks, and they're all short. They only go for about 7 minutes. So now we've talked about, and now I'm going to go back to load management, okay? Because load management, that cup that you have, what happens is if you get this right, if you get this wrong, you're constantly overflowing that cup. And for those of you that have just joined the live stream, load is the combination of intensity and volume. So intensity is how heavy you're lifting, volume is how much you're doing. So volume is how many reps per set, how many sets in a workout, or how many sets on a muscle group in a workout, and how many workouts on that muscle group in a week. That's volume. And load is the combination of those two together. So load management, or load capacity, I should say now, is your capacity to handle load. So think about your load capacity as a cup. That's how much load you can handle. If the load that goes into the cup is like water going into the cup, filling it up. If you exceed your load capacity, if the cup starts overflowing, that's when you start getting injured. That's when the system starts breaking down. So again, I'm just brushing over this really quickly, but you do need to hear this stuff multiple times to really understand it. So you've got your load capacity, you've got a slap tear, your load capacity has now decreased, so your cup is even smaller. You can't handle as much as you could before the injury, probably a lot less. And just by going through your day-to-day activity, you're putting load on that shoulder. Unless you completely immobilize the shoulder, which is very, very bad, because now your muscles are atrophying, you're not training strength, the muscle systems that control, so the neuromuscular connection between the rotator cuff and the scapula stabilizers, which are these deeper inner unit of stabilization systems, which stabilize the scapula, which keep the humerus in the glenohumeral joint, so it keeps it up here and it prevents this joint glide. It keeps it moving like this. That's the job of the rotator cuff. Those muscle systems go to sleep when you rest, and they stop doing their job properly. And so now the rotator cuff that's meant to hold that humerus in the glenohumeral joint and keep it locked in there so that when you get movement, the movement occurs like this. Now it's not doing its job properly and you're getting this joint glide. And that's what causes those sharp, agonizing pains when you try and lift your arm up, and instead of the humerus moving like that in the glenohumeral joint, it starts moving like this, and you get to here and you go, and you get this sharp pain. And so it is vital that you train those systems right from the start of your slap tear recovery. And this is why surgery, it doesn't fix the issues that you're having. Because surgery itself, although it can, well, it does reattach the labrum, And in some cases, in some very severe cases, surgery might be what you need. But in the vast majority of people that are sending me their MRIs and that I'm working with, it is not what they need. Because even when you get surgery, surgery doesn't reawaken the rotator cuff muscles for you. In fact, it puts them even more to sleep. It means that rehab is even more important after surgery. So it's not like you can go and get surgery and go, hey, I'm back to full function. Now I can do whatever I want. You still need to do everything that I'm describing here. But now you'll need it even more after you've done surgery. So rest isn't best. So we want to go to the gym. We want to be doing our exercise, but we've gone through our day and we've added load to the shoulder already. So the shoulder is already like that little cup that's even smaller than it was before is already halfway full. And then you go to the gym. You don't know how to manage load. You do what seems like a really insignificant light workout and you overflow that cup and you get pain. But here's the kicker. This is how progressive overload and how adaptation works. When you get load management right, so when you do a workout that doesn't exceed your load capacity, guess what? The cup grows, and it grows at a small rate. But that tiny little thimble, that little shot glass, over several weeks grows back to the size of the cup that it was before the injury. So guess what? Now your shoulder can handle more. And for me, because I've been doing this for so long, my cup is more like a bucket. So my load capacity is like a bucket. So what for you, where your load capacity is a cup, and you might look at my workouts on YouTube and go, I could never do that. Well, I couldn't do that when I started my slap tear rehab journey either. I had the little cup and I had to do the same little thing. I had to just pour little bits of water in that cup. But now because my cup has grown to a bucket and I can handle so much more, the load that would cause your cup to overflow and cause tremendous pain, pour that in my bucket and it barely fills it up this much. It's nothing. And that's what happens when you do good programming with periodization, which means that each program phase builds on the last one and allows you to grow that cup safely and effectively. And that's called adaptation. Your body adapts to the workouts that you're doing. So it's an incredible process that is predictable when you do it the right way. It is predictable that you will get from here to here in X amount of time frame as if you follow the process. So BD is saying, I started with a slap 2 and now have a frozen shoulder diagnosis. That is a real bummer, and I'm going to talk about that in a minute. But before I do, I'll be wrapping this up in a minute. So if any of you guys have questions on TikTok, on Instagram, or on YouTube, put them up and I'll answer them for you before I finish this. Frozen shoulder, I've dealt with several times with clients. I've never had it myself, but I've dealt with it with clients and I've rehabilitated it with several clients. Frozen shoulder is a really nasty injury to have. Frozen shoulder is actually one of the very few shoulder injuries where in some cases, rest is the only thing that improves symptoms, which is a real bummer because I know that I've just told you that rest is not best for a slap tear, but unfortunately with frozen shoulder, we need to take care of that first. Now, it might not necessarily mean that you have to rest. I've rehabilitated 4 people's frozen shoulders. 3 of them we were able to work out the whole time. 1 of them we had to really reduce their movement in that shoulder, and we had to just basically work on lower body strength for a while until they were able to start to move their shoulder a bit more pain-free, and then we could start adding exercise. So what we need to, what you want to be doing is you want to be doing very, very smart load management with your slap tear rehab, and you want to see if it makes that frozen shoulder worse. And you're going to be lifting very light weights. Like you really want to be basically training that pain-free range of motion, but without, you want to be trying to push that pain-free range of motion, but guidance is really important for this. And I'm going to do the shameless plug here because again, I get told this by our members that are giving me these 5-star Google reviews for their slap tear rehab. I know that for everybody, when you're thinking about having to rehabilitate a shoulder and having to work with a coach and having to do all of this stuff, you think about the cost involved. Of course, there's a financial cost that we all have to stomach. So to work with me online is $79 a month. weigh that up against what it costs for you to go to a couple of physiotherapy sessions and to see a doctor and a surgeon. So if you had a slap tear and you're weighing up your options and you go to the doctor and you get a referral to see a specialist, and you go to the specialist and you have to pay for the specialist treatment, in Australia, that's about anywhere from $200 to $300. Then the specialist says you need to go and see a surgeon and see what the surgeon says. You book in with the surgeon. Just to go and see the surgeon costs you again $200 to $300. So now we're at the $400 to $600 mark. And then that's plus whatever you've spent on physiotherapy to try to fix it, which with everybody that I'm working with online, that was ineffective for them. They went and saw physiotherapists and it didn't fix their slap tear. It didn't even improve their symptoms. And the physiotherapy sessions are probably around $130 to $140 each. So we're talking anywhere from, $600 to $1,000 for zero change in your slap tear. Like, you've now just been given this horrible diagnosis and information, and people telling you, yep, you're probably going to need surgery. You've been to a physiotherapist a couple of times. They've given you a couple of dicky exercises for you to go and do on your own. You probably aren't going to see them more than 2 or 3 times because of the cost involved in it. I don't know many people that are willing to stomach the cost of one physiotherapy session a week for a long period of time. You weigh that up against working with me online, where it costs you $79 a month. So for one whole month is less than one appointment with a physiotherapist, and you get feedback from me and my team whenever you want. So people within my UMS online coaching, they post videos whenever they want. There's no limit to it. And I review the videos via screen recording. So I'm watching their video, doing a screen recording, say, this is what we want to do. You want to do it more like this, less like that, and answering their questions. And if you think about that, and I know this is a shameless plug, but I've been down this road myself, and I know how important regular guidance is, and I'll tell you the guidance that I had in just a second. But if you weigh that up against what the other option is and what the cost is, and also that you could do 2 or 3 months with me and you'd still spend less than what you'd spend on 2 physiotherapy sessions, and it works. What I do works. People get results immediately, like within the first week. If you go and watch Freezy's video, he talks about how his shoulder started to feel better after 1 week. So, ask yourself, guys, which cost you'd rather spend. What would you rather spend your money on? Would you rather spend your money on going to see surgeons that are almost certainly going to tell you need surgery? Or if not, they're going to say, you can maybe get away with not getting surgery if you go and do some good physiotherapy, and you're going to pay $200 or $300 for that. That's what they're going to tell you. If you then get that, like I get so many people coming to me saying, I went to a surgeon, they told me I need surgery, what do you think? And then I tell them exactly what I'm telling you, and then they decide to come along and try the training, and it makes them better. It improves their symptoms, it reduces their pain, all of that stuff. Why would you need to go and pay a surgeon to tell you that first? Like, if you've had your MRI, I mean, I'll tell you guys now how I know so much about this. Because I'm a personal trainer. I'm not a surgeon, I'm not a doctor, and I'm not a physiotherapist. But what I am fortunate enough is that I've been in this industry for 20 years. And in the 20 years that I've been in this industry, I've befriended some of the world's best physiotherapists. And the people that I've befriended, that my brother Yanni and I have befriended, we were trying to take count of how this happened for us. And I don't really know exactly how we became good friends with these guys and respected by them, but we just, I guess we never tried to step out of our lane, and we never tried to show that we could do things that we didn't. And when you do that as a personal trainer, people like physiotherapists, they don't respect you at all. And so we created a referral network with a couple of these guys, and because we were seeing enough of our clients were seeing good physiotherapists, we only went back to the good ones. And the guys that we made relationships with over in the last, we made relationships with them 15 or 20 years ago, and about 5 years ago, 2 of these guys became physiotherapists for 2 of the elite football clubs in Australia. So to get a job as a physiotherapist for a professional football club, you have to be the best of the best. That is like the holy grail of job selection for a physiotherapist. And these guys, the way that, they did, 10 years, 11 years in that career. And then when I had my slap tear, I reached out to them because I went and saw a surgeon. I did exactly what I'm telling you guys not to do. And I saw 3 surgeons, and they all said, yep, you need surgery. And then I I said, stuff that. And I reached out to my physiotherapist. I also saw Joe Blogg's physiotherapist, just the physio down the road. And he was like not very confident about how the rehab was going to go. And so I reached out to my friend who doesn't see the public. He only treats professional athletes. But because of our relationship, he said, yep, you can come and see me. And I had to go out to get my treatments at the physiotherapy clinic for the GWS Giants, which is a Sydney AFL football club, Australian Football League. So it's the highest code of football in Australia. It's the highest paid athletes, most watched football, very, very, very good athletes. And I was out there in the same clinic where the athletes were getting treated. And the only way that I got access to that was because of my relationship with Leroy. Anyway, his approach was so vastly different to what the surgeons and the physiotherapists that I'd seen that it was like he was talking a different language. He just came into me and he just said, "Yeah, we're going to strengthen these guys and strengthen these guys. We're going to awaken your scapular stabilizers, your rotator cuff, blah 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 blah. Do these exercises." And I went and saw him once a week for several months, and my slap tear, my symptoms just got better and better and better and better. Took me about 12 months to get back to full strength with this one because I was only able to see Leroy once a week. But the second slap tear that I had, one of Leroy's associates, so somebody that worked with Leroy at the GWS Giants, who I only know now because of my relationship with Leroy, and we've now become good friends. His name is Nilesh Murthy, and he is now the head sports physiotherapist for the Newcastle Knights, another one of the biggest football clubs in Australia. And during the COVID lockdowns in, I think it was 2020 when it was happening. It might have been 2021 when we had our second lockdown, because it wasn't during the first lockdown, it was during the second lockdown. So I can't remember the exact date. But his whole team was told that if you want to come to work, you need to be in a COVID bubble, basically where you can't leave, so that you're not getting exposed to, like they tried to keep the sports going during COVID. They created these COVID bubbles where the athletes and the trainers and the physiotherapists and everything, they didn't see anybody outside of the football league for the entire season. And he said, no, I'm not going to do that because he had a young child and a wife. And so he was stood down to light duties and basically consultation. And so he had all this time on his hand, and he approached us and said, hey, can I come? Because we'd made a physiotherapy clinic in our gym for our other physiotherapist friend, Phil White, who you may have seen on our podcast. And he came in and he asked if he could treat people during that period of time. And so for the next year, he was in the gym treating people, which means he was there every day. He was at work with me every day. And so when I was rehabilitating this slap tear, I had a world-class physiotherapist, one of the best in the world, who was right there with me every day. And all of the knowledge and all of the understanding of slap tear rehab that I'd already got from my first slap tear, I was able to bounce off him as I was doing it, and he would refine it and give me a deeper understanding of it. And that level of connection with a physical therapist, I doubt anybody, I shouldn't say that. You can't say never. You can never say never. I doubt many people in the world have ever had that level of connection with a physical therapist. Even a professional athlete has appointments with the physiotherapist once a day or every second day or once a week or whatever it is. But I had him there every day that I was just able, when we were training together every day. So as I was doing every workout, he was training with me and talking me through whatever I was experiencing and whatever I was feeling. And that's how I know so much about slap tear rehab. That's how I was able to rehabilitate both my slap tears without surgery. And that's how I've been able to create a system where I can do the same results for people around the world via online coaching. And it works. And if you don't believe me, go and watch some of those videos that I just referenced on YouTube, and go and look at our Google reviews, all verified by Google reviews as well. So I've got a whole bunch of comments here on YouTube. If any of you guys on Instagram or TikTok have questions for me about slap tears, then post them and I'll answer them. So Singing Dancing Muscle Man is saying, in my experience dealing with frozen shoulder diagnosis and other severely limiting shoulder injuries, the use of overcoming isometrics can be a life-changing place to start. Isometrics are very, very good. But isometrics are where you go if the starting place that I'm referring to is too much. So isometrics are where you go when the symptoms are really bad. And for most people, they don't need to go that far back. Some people do, but for most people, we can skip that phase. And usually for isometrics, you usually only need to do it for about 2 or 3 weeks. It's usually a pretty short amount of time before you can start doing some concentric loading. And then eccentric loading is the last thing that you do. Eccentric loading is the most demanding on the injury. A video, Sava is saying, I went to 4 different physios, and in the end, I needed an MRI scan to confirm the diagnosis, which in the end, it was not a slap tear. Yeah, I remember. So, you know, it's always important to get a diagnosis and make sure that you understand what you're dealing with. But at the same time, you know what's funny? The treatment for most shoulder injuries is the same. It's not like the shoulder is a complex joint, but the rehabilitation process is very similar for most injuries. You need to reawaken the rotator cuff muscles through a series of exercises. You need to reawaken the scapular stabilizers so that you don't have dysfunctional scapular movement. Both of those things cause joint glide and, you know, shoulder impingement and agonizing pain. And you need to build as much strength and muscle mass as you can in the prime movers, the pecs, the deltoids, the lats, the biceps, the triceps. So yeah, regardless of if you've had a slap tear or people come to me with, I've got a Bankart tear, I've got you know, a labrum tear, but it's not a slap tear. I've got a torn supraspinatus. Whatever it is, this process works. It works for all of it. Singing Dancing Muscle Man is saying 5 sets of 5 seconds of isometric holds in shoulder flexion, extension, external rotation, internal rotation, abduction, adduction. Yeah, great place to start if you're that bad, you know. And yes, with frozen shoulder, so back for BD Davis, that might be somewhere where you need to start. But, you know, I'd need to see how you're moving and how you respond to exercises to be able to give specific advice. And Singing Dancing Muscle Man saying, even using those 5 sets of 5 seconds of all 6 of the isometric holds have been very valuable to me, even just as warm-up. Yeah, for sure. Yeah, they're good. All right, team. I really hope that you got something out of this. If you've made it this far, please subscribe to my YouTube channel. Please take a moment or follow me on the socials that you're watching me. It really helps me to know that this content that I'm putting out is valuable for you guys. And I put a lot of work into giving valuable advice. That's why I do these live streams, and I do less of the, you know, the big long form videos anymore and the clickbait shorts, even though I do these funny little shorts now where I show people failing because they make me laugh. So yeah, please take a moment, click that subscribe button, follow me on socials, and share the love. And I will, and hit that like button on the stream as well. And get your questions in. If you've got questions, comment on my post, send me a DM, and I will, I'll answer, you know, the best questions that are relevant to the community on these live streams. And I'll see you guys all tomorrow for my next show. I go live at the same time every day, wherever you're watching in the world. 44 minutes ago from whatever time zone you're in now, 44 minutes ago is when I go live, Monday to Friday, which if you're in the United States or Europe, that means Sunday to Thursday. I'll see you all tomorrow.